All right. Well, it's great to have you all here. I'm Jenny Ekstrom. I operate under the alias of Uncluttered Mind MD, and I'm talking about all things real estate, private practice, entrepreneurship. And so today's, hi, Celine. Today's session is really around IT security, specifically around HIPAA compliance and those issues. And so full disclosure, I have invited one of my favorite IT people who happens to also be my husband, who has been in IT for over 25 years, I believe. A long time. I've known him a very long time.
I think it's 22.
Okay, we'll take 22. And so today's session is really designed for clinicians, private practice, group practice, solo entrepreneurs, all of those pieces, really understanding how we protect ourselves in a realm of IT security, specifically around HIPAA. But these principles are really applicable no matter where you find yourself in your business. So I think when we look at IT services and that is a bottom line expense in our businesses, it's very easy to say, gosh, what value am I getting from this? It's not a revenue generator. It's like, any other insurance policy. How much do I need? And the answer is, I think, for me personally, I think we always assumed that we had enough protection until you don't. And so this is really why I think it's important to bring this conversation to the forefront. I mean, we see security breaches almost daily. And so it's really not a matter of if it'll happen to you, it's a matter of when it'll happen to you. So with that, I would like to go ahead and introduce Andrew Ekstrom with Succurri. I'll let him do his introduction and we'll go from there.
Yeah, terrific. Thanks, Jenny. It is fun to get to co-host something like this with you. I get to hear, your meetings you have through the closed office door. So now getting to be part of one is great. So I gave this presentation actually just at the end of October at the Rheumatology Private Practice Alliance Growth Summit in LA. It was great. We had like 100 attendees and very engaged group. Rheumatologists were great students of my my presentation and just great people, and the conference was great as well. So after we gave that presentation, there was a lot of interest from different people, and so I appreciate you letting me utilize your platform to talk with everybody and give this presentation. So really, this presentation is designed for business owners or like practice managers who need to have a framework to understand at a 30,000-foot view what IT security needs to look like in the context of compliance with HIPAA. And the goal is really to, by the end of this presentation, to be able to speak, have an educated understanding of what's going on and speak with IT professionals and set goals for them. So that being said, I'm going to jump into my presentation here. So one second. And can you see the presentation?
I can. Can somebody just comment in the chat that you can see it as well? Perfect. Thank you.
Perfect. And so if I turn my head, because my presentation's on my other screen, but we'll go through here. So, basically the gist of this presentation is keeping your practice secure in a digital age. Make sure I have the right keyboard here. So just a little bit about me. Once again, my name is Andrew Ekstrom. I am one of the managing partners at Succurri LLC. My skill set, I am a network engineer. 23 years. I've been doing network engineering for 23 years, basically started right out of college. My certifications are industry certifications, so MCFE and A+. My formal education is a bachelor's of finance, actually, from Seattle Pacific University. And then I like to say that I've gotten a PhD in the School of Hard Knocks. So being a business owner, starting a consulting firm, and working through the process has helped me gain a lot of knowledge and practical experience. I'm married, of course, to our beautiful co-host here, Jenny, for 22 years. I have 2 high school age children and 1 black lab. So a little bit about my company. So the industry we're in is technology consulting. We do services and solutions. So those services are networking, backup and disaster recovery, information security, software design, process automation, and strategic consulting. We cover the majority of the Western United States. We have customers all over the country, just our focus areas in the Western United States. So we work out of the state of Washington, specifically north of Seattle and in Everett, and span up to the Canadian border for Bellingham. We have an office in Montana where I'm located and cover the whole state. And then we have just opened up service in the Phoenix metro area. So we're very excited about that. We have 27 staff members. Of those, we have 19 engineers, 4 software engineers, and 4 administrative staff. And our guiding principle is really that business goals need to drive every technology decision. And this is something I really highlight to anyone listening, because what will happen when you talk with an IT professional, they're going to come at you with recommendations for technology. We want to make sure those recommendations are based on achieving business goals, not just technology for technology's sake. And really, that's going to be an overarching part of this discussion, this presentation. So disclaimer, this presentation is for educational purposes only. It doesn't entail a business relationship. And if you are looking for advice, we recommend you contact your legal counsel or discuss your questions with the Department of Health and Human Services, specifically relating to compliance. From an IT standpoint, we advise customers on these kind of things all the time. So really, there's 2 questions I get asked a lot. One is what is compliance and what is security, and how are they different? And so compliance is really the act of documenting, or I should say it's auditing, documenting, and assessing the current state of in this case, computer system or a company's computer systems, and applying that against a security framework like HIPAA. And so it's very much the paperwork side, it's the process side, it's the documentation side of this conversation. Security is the actual act of putting in place something that will protect you or your business or your information from an attack. And so they're very, very different, and I'll go into both of those. So Jenny, would you mind running the first survey, which is going to be for compliance? And this survey, if everyone can say yes or no, what I'm looking for is I'm collecting data across my presentations for those who, if you, your clinic, or someone you know personally has actually been audited by Health and Human Services. And so if you have, just answer yes, and if you haven't, answer no. And I'm going to keep moving through this as those results come in. So why are we talking about this subject to start out with? So really, it's all about protected information. And why should you care about that information as a clinician or as a business owner? So it's electronic protected healthcare information. And these are things like your first and last name, social security number, date of birth, diagnosis code, your medical history, things that your patients want to be private and could potentially be hazardous, if it was publicly accessible. And so many years ago, the United States government put into law basically HIPAA, which is the Health Insurance Portability and Accountability Act. It was placed into law in 1996. And this law was designed to protect patient information as patient information began to flow through electronic systems, through computer systems. And they realized it could be intercepted or it could be captured and used inappropriately. So it is law. I have at the bottom the reference for that with that QR code. So who's covered by this? So we're going to go over those who are covered entities. We're going to talk about business associates, and those are the people that have access to electronic patient information through a covered entity, so like a subcontractor, and basically talk more about what's protected, the electronic protected health information. So who's a covered entity? And this is a really important point to point out. So you have health plans like insurance companies, Medicare, Medicaid, HMOs, PPOs, and et cetera. Any large organization that provides insurance and as part of that process needs access to patient information. Clearinghouses. So these are organizations that process EPHI. They may be between an insurance carrier or a laboratory, but they're ultimately getting their hands on EPHI. And then providers. So this is where I have questions frequently of practitioners I work with say, hey, but I'm not really covered by this. And so the rules of the HIPAA security agreement basically state that if you're a doctor, your clinic, the business itself, if you're a dentist, chiropractor, a nursing home, pharmacy, et cetera, you have access to protected health information and you're a covered entity. And so, I asked the question, are you covered? And if you fit into any of those, then you certainly are. I had a customer once let me know that they felt that they weren't covered because they didn't take insurance. And so although the name, the HIPAA security guidelines have insurance in the name, if you're a physician and you have electronic patient information, you are a covered entity. So business associates, this is one I get a lot of questions about right now. So we all have, so in the structure, you're going to have your clinic and you're going to have your providers. So your providers and your clinic are basically the covered entities. They're the umbrella organization. And then along with that, any staff member that's part of that clinic is going to be considered part of the covered entity. Lots of clinics now are outsourcing to virtual assistants. It's become very popular. And so I get a lot of questions about virtual assistants, but I'll go through here basically. So first, what is a business associate? It's someone who doesn't work for your clinic or your organization like as a W-2 employee. They're a contractor of some kind. So it could be a vendor, a contractor, a temporary staff member, a service provider, or anyone who has access to electronic patient information who's not directly employed by you. Are there exceptions? Yes, there are actually several. My recommendation though, and for the sake of this presentation, I'm not providing those because I think they open up the door for interpretation. Whereas what I would tell you is if you have access to EPHI and you have a contractor or someone who doesn't work for you that's getting access to it through your organization, assume that they're covered, that they're required to be covered as a business associate. But I do have a link through that QR code to give you access to the specifics of the business associate information as far as Health and Human Services wants to give that. So I did give some examples, but like if you have a 1099 contractor, a virtual assistant, a vendor that hosts or houses your EPHI, a big one is EMRs, practice management systems, dictation tools. If they're housing that, they're a business associate. Vendors, and then IT companies like my own. So the most important part of the business associate is knowing your responsibilities, your requirements. So as a covered entity, you are basically overseeing the activities of the business associate as far as their access to the EPHI that you control. And that's really the critical thing, is that you do have to have oversight. And in that process, there's some things to be aware of. So you, as the covered entity, are responsible for ensuring that the business associate is meeting HIPAA security rules. And so the covered entity, you're responsible for policing that business associate and making sure that they are doing what they're supposed to be doing, and that they're making sure that they're taking care of all their data protection. Also, if there's a breach, likely that breach will flow up from the business associate up into the covered entity. So there's a chain of custody in this process. So one of the requirements that's called out by HIPAA is that you need to have what's called a business associates agreement, and that is a written legal document between a covered entity and a business associate, and it basically states that the business associate will follow the covered entity's security requirements as it pertains to HIPAA. This is a specific document called out in the HIPAA guidelines, and I actually have a link to that here with that QR code. And so make sure that's a template. Just to make sure if you have any business associates that they are signing that document. One of the things to also be aware of is that as a covered entity, you need to make sure that you are collecting information from your business associates to document the fact that they are meeting HIPAA security requirements. And so this comes in lots of different ways. It can be that the business associate provides you with a written security plan. They give you copies of their security audits. They give you a list of the employee training they're doing and the results of their vulnerability testing. There's a lot of different ways I see this happening. But as the covered entity, you're ultimately responsible for that oversight and getting that documentation to prove that the business associate's been doing what they're supposed to. From a legal standpoint, the more documentation you have as the covered entity, the more likely you are to be able to go through and, if there is an audit or if there's a breach, to document that you've done your due diligence. So now we've talked a little bit about HIPAA. The thing that we have to realize is HIPAA is a set of guidelines, and the guidelines help us navigate the process of HIPAA compliance. The National Institute of Standards has put together a document that actually outlines the guidelines, which is great. I called it the HIPAA Bible. It is a rather large document. There's two QR codes. One is to the landing page from Health and Human Services. One is to the actual document from the National Institute of Standards. The document's really important because this should be the way you communicate with your IT professional about what's actually happening for compliance and for security too. So in the document, there's a lot of information provided, a lot of directions. There is a section that has basically a spreadsheet, and the spreadsheet outlines how you go about the process of becoming compliant. And so we'll go into that here in just a second. Oops. So the first part of this process with the National Institute of Standards guidelines is you're going to do a compliance audit. And so what that means is you or your IT professional is going through and looking at all of the systems in your clinic, and they are matching those to the systems in the NIST guidelines. And I'll use some terminology. So NIST is how I'll refer to the National Institute of Standards. So in the NIST document, there's going to be things called measures. And a measure is a unique system or procedure or process that needs to be audited. So let's say there's a measure that says you have to have passwords. So in that scenario, you would have an audit done by someone and they would determine, yes, everyone has passwords. So the results of that audit would be, yes, there are passwords. Let's say that there's another one that says you have to have an offsite backup. And so you do the audit and you realize you don't have an offsite backup. So the answer is going to be no. And once you've completed all of those assessments, then what happens is there's a gap analysis. The gap analysis is a document that is basically, it shows you the difference between the measures required security, or the measure, like that the National Institute of Standards makes you do, and what you've done in your clinic. So in the first scenario, I said, yes, we have passwords. So that would show up as nothing that needs to be changed. But in the second scenario where I said, do we have offsite backup? I said, no. So now we have a gap between the measure and what is actually happening at the company. And so the gap analysis is a list of those places where we don't have full security, where we may have some discrepancies. And it provides the clinician or the practice manager or the business owner with basically an action item list. So the next thing that happens is with that gap analysis, the IT professional should be providing a recommendation for remediation. Remediation basically just means fixing or changing the things that didn't fit. So in the example I gave, it would be putting in an offsite backup. And so we'd put in the offsite backup, we'll have remediated the discrepancy in the gap analysis, and we're now meeting the measure. The next thing that happens is, as you've gone through and you've remediated all of those items in the gap analysis, you then go through and you do staff training. And so the goal is to make sure the staff now understands the new systems in place, how they are to interact with EPHI, and now they can go through and be effective team members versus potentially a vulnerability. After you've done all of those things, then we enter a maintenance phase where we do monitoring. So we're looking for logs, we're reviewing systems, we're addressing events that come up. This is generally the IT professionals are looking at these because it's events or logs that are generated by the different systems. And then about every year, you go through and you repeat this process and you perform the audit again in the gap analysis. The great thing is the second time you do it, the third or fourth or fifth, it gets easier because you've already knocked out the majority of the items that were in the gap analysis the first time. And the NIST doesn't add new measures frequently. So it's not like every year there's 50 new measures. Really, so this process becomes more efficient and faster every time. So we talk about, now that I've just told you, you have to go look up a really big document on the National Institute of Standards website, and that there's hundreds of measures you have to go through. There's now cost to auditing, and there's time spent developing the gap analysis and so forth. So what I've encountered, these are the 7 stages of compliance. I tied them to the 7 stages of grief. And so, because unfortunately, doing audit and compliance, brings a lot of people grief. So the first thing I always hear is, this doesn't apply to me. I'm in denial. I don't want to do this. So we talked through figuring out, yes, you are a covered entity. Yes, you have business associates. You actually do have to do this. It's law. I'm not an auditor, and I don't enforce customers to do this, but I do help them through this process. So then the next phase is anger. They get mad. This isn't fair. How can I afford to do this? It's going to cost me lots of money. Once they pass through that phase and we chat with them, like it is a process that is going to cost you resources and time, but once you've done it, you'll be in a much better place. We enter the phase of bargaining. And so this is, unfortunately, the next 2 are very dangerous phases. So the phase of bargaining is where I hear, oh, well, my IT already takes care of us. We're secure. And well, that could be the case, but you're not compliant unless you've actually gone through and performed the audit and the gap analysis. And so oftentimes their level of comfort, or they've convinced themselves that they are secure, leads them to stop at this phase. And that's where things can start to become problematic. The next phase is, they've accepted that they have to do this and they just don't have time. And so they've entered the phase of neglect. And this is where things really pivot in the wrong direction. And I hear this frequently. I'm just too busy doing my real job. I don't have time to do all this other stuff that the government's imposing on me. So this is where their security and compliance journey ends for a period of time. And then, unfortunately, at some point in the future, they get a security breach. And so things change rapidly at that point. There's lots of panic, fear, anxiety, and dread. I get a phone call at that point, and we start to work through this process. So the next phase then is the consequences of that breach. So now your patient's electronic healthcare information is no longer secure. It's been accessed by an entity or an organization that is not your company, and there's a lot that has to be done to take care of that. So, there's going to be consequences. Health and Human Services requires by law that you report any breaches to them. And at that point, they get engaged, and they now tell you how things are going to go. So there is a loss of control. They will likely require public announcements of the breach, which, public opinion starts to shift at that point. You lose trust with your patients. Oftentimes there's ransoms that need to be paid, and those can equal a ton of money. And like I said, there could be fines. And so, we'll delve into that one a little bit more. And then the last phase is remediation. So now you're doing the audits you would have done anyways. You're paying for them regardless because now you no longer have an option to do with it. You're getting proposals and quotes, and you're making decisions. You're putting new systems in place. It's new processes. It's a lot happening, and it's not on your time frame, and it costs a lot of money. And ultimately, if you had done the compliance ahead of time, potentially could have avoided the last 3 or 4 phases. So the next, Jenny, if you could launch the next survey for us. And so on this survey, I'm going to be asking you if you personally, your clinic, or someone you know has been involved in a security breach of some kind. And it doesn't have to be a healthcare related security breach. It could be credit card, banking, identity theft, just anything that might come up. So while we are gathering that information, I'll keep on moving. So practical IT security. So we're shifting now from the compliance side of things to what we do a lot in our firm, which is the actual securing of the systems. And so I want to bring some terminology to this discussion that you can use and use it as a reference point. And truthfully, practical IT security is a lot easier than you think. We actually, at the end of this, I'll be making an offer for an ebook we have, which is called the 13 Cybersecurity Tips that are almost free. It's not all about money and time and cost. Oftentimes it's changes of habit. So we're going to talk about your attack surface. So where are your blind spots? We're going to talk about something that's only for your eyes, which is the little dirty secret of compliance. And we're going to talk about risk management, which are basically techniques we use to prevent the breaches from happening and keep your EPHI secure. So attack surface. I often use the analogy of a wedge of Swiss cheese. And so if you remember Swiss cheese, it has big holes and medium holes and little holes. And if you think of your computer system as a wedge of Swiss cheese and your EPHI lives in the middle of that, you have big holes that can get to the EPHI, you have medium-sized holes, and you have little holes. The goal is we want to be at the very beginning, like right now, we want to be working through getting the big holes blocked. The next thing is working through the medium-sized holes. And sometimes the little holes are not possible to block, and we have to just be aware of them and do our best to minimize the risk that those little holes prevent. So now I'm going to go into the discussions of how the attacks happen and where they come from. I'm going to have some stories here. Jenny has mentioned she might potentially be sharing a story as well. So I'm just going to jump in. So what are the bad guys and girls after? Well, 30 years ago, it was all about prestige. How, that people showing how smart they were, they could get into computer systems, they were hackers, and it was very much a technical thing. There was almost no monetary value associated with it. Then things shifted, 25 years ago, it became about causing chaos. So the viruses that could spread around the world the fastest, they could be the most damaging, they were the ones that were the most infectious, still not any real monetary component to it. Well, in the last 10 years, that has really shifted. We don't see those hackers that are trying to do this for prestige anymore. We don't see the big viruses that spread around the world quickly that cause chaos. What we're seeing now is organized crime from around the world is really leveraging security vulnerabilities to make money. And it's big business. On average, cybercrime generates a 13% return on investment. And a lot of the countries that these criminal organizations reside in have absolutely no laws or enforcement. And there's really little recourse. So this crime happens across the ocean or around the world. It is harmless, effectively harmless. And so there's not a lot that our own country does to prevent it. So if you get a breach, the FBI and the CIA are not going to be out there pounding the ground trying to help you out. So what are they looking for? Well, it's several things. So what they're looking for is how to monetize the information that they find. And so there's two directives. So from a clinic standpoint, an EPHI standpoint, they are looking for the information that they can ransom. So what they'll do is they'll go into an organization and they will take control of the data and then they ransom it. And so, Jenny, I didn't know, were you interested in sharing it all? Because I think yours would be a really good example for this.
Well, I think the only piece, and I'll just be specifically a little vague, but I think the idea that we are protected and that false senses of security, that the decisions we may have made to, think we had offsite data backup, or that we were doing okay with our password hygiene, or those pieces, like really, unless you are looking at this on an annual basis, we may be lulled into a false sense of security at either thinking, I think we've done enough and we'll probably get by, or relying on changes you may made that may not have continued, either because relationships didn't continue, or things got too expensive, and it's not very sexy to spend a ton of money on these things because it doesn't feel like there's a lot of return until everything comes to a grinding halt. So
terrific. So I'm going to run a fictitious case study, and so in a corporation where you have an IT professional that's on staff, oftentimes that IT professional will be busy with just the day-to-day needs of that clinic, right? I can't log into my EMR, my laptop isn't starting up, I need to connect to the Wi-Fi, the day-to-day needs. And oftentimes what happens is that person, that IT professional, doesn't have the resources or the time they need to really focus on the security side of things. And truthfully, as a network engineer myself, we're not trained on security and compliance out of the gate. It's an advanced information and skill set. And so oftentimes a company that can only hire one IT professional, or even if they're hiring like a consulting company, that company might not have security and compliance expertise. And so they're very much focused on the things they can resolve, which is getting that person back on their ECW or their Citrix or whatever it is that they're using, and making sure the Wi-Fi connects. And so the security components fall apart. So in this scenario that I'm going to work through, I'll just walk you through the phases of how this happens. So let's say you have an IT administrator. They are using their PC to do administrative functions. Their user account has administrative level access, and they're basically they can do anything they want as far as the computer system is concerned. And so they're going along, taking care of the day-to-day issues, running a little bit, a little hot, falling behind on things, and they get an email. It looks legitimate. It says it's from their boss, and they click on it, and ultimately, as far as they can tell, nothing happens. But what they don't realize is in the background, a malicious code was installed, and this malicious code enabled remote access to this person's computer. And so nothing immediately happens, right? There's no big bang or emails flying out. What happens is this program just sits in the background and starts watching. And this is really what we see happen. And so the program is running in the background. The IT professional goes home for the day. It's actually now the weekend. And now that the hackers or the cyber criminals realize the computer has gone idle, they hop on the computer and they start to explore it. They figure out that that they have access to an admin level account. They start to browse the network. They realize that there's a server there or multiple servers. And so what they do is get a really good sense of what's going on. And then they use those admin credentials to log onto the server. They see what kind of information is there. We've got a patient information database. We've got lots of financial information, lots of secured information. So now they know they have something of value. So the next thing they do is they say, well, we want to make sure we can extract the most money out of this investment of their hack as possible. So they get on and they basically, as the administrator, destroy all backups. And they do their best to basically get rid of those so that there's no recourse. They then go through and they do what's called exfiltration of information, which is a fancy way of saying they copy all that information to somewhere else on the internet. Likely they're dumping it on the dark web for sale. And so they do that. They then hold the company hostage. And they do this by what's called crypto locking. And if you have heard recently, there's been a number of big hacks or like crypto locking events in the last couple of weeks. Henry Schein, a major medical provider, had a crypto lock. MGM Grand, the big casino, there's actually 2 casinos, they got crypto locked. And what that means is the hackers encrypt or make all the data on that server unreadable. And they try and make all data on all computers unreadable. The only way you can read it is by decrypting it. You have to have a decryption key that the hackers provide to you. And so the way you get that key is by paying a ransom. When this first started out, the ransoms were very small. It was usually $100, and you would go use PayPal and send $100 via credit card to some account somewhere in Asia or Russia. It has escalated significantly, and we see ransoms now in the tens to hundreds of thousands of dollars. And the reason they can get those ransoms is because the companies they're locking down have a constant cost to being open for business, right? So if you have 5 or 10 or 15 employees, you have a lot of expense to keep the lights on in your business running every day. So all of a sudden, well, you know, if I can never get access to my data, or I'm going to be down for weeks or a month, I have to keep running my business, and it's going to cost me $20,000 to $50,000 of lost revenue. I might as well pay the ransom and just get back to life. So when that happens, usually the insurance companies get involved. So if you don't have a cybersecurity insurance policy, I highly recommend it. If you do have one, definitely take a look at what they pay in the event of a ransom. And I will say insurance companies are becoming very, very sophisticated at this process because they are paying out lots of money. 4 years ago, we would have 2 questions on an insurance questionnaire that were related to IT. Now it's 2 pages, and we have to have our security expert go through and fill those out. So the insurance companies are very aware that there's a very high likelihood of having to pay out in these events, and they want to make sure the people they're insuring are safe. So that would be what I'll call like the traditional ransomware scenario. The other way we see things happening, and this is not medical specific, but it covers any business, is the money transfers and payrolls. So for a long, long time, we had customers tell us, oh, my business is too small. I'm not Target. I'm not Bank of America. Why would they want me? And that was true at that time. But now that the world of cybersecurity, or the cyber world has grown so much, and everyone's computers are connected, the access to financial information and the access to the transfer of funds has become really easy to get into. So a couple of scenarios here. So this is in my own customer base. These were customers that had either accepted or not accepted some of our security recommendations, and things turned out differently for them. So neither of these are medical. One company recently had a breach, and it wasn't very significant, but what happened was they'd been paying a vendor. The employee at this company had a security breach in her email account, and that's really the way they get in. And the hackers just watched her send emails back and forth. And then from there, they were able to figure out that she was paying vendors many thousands of dollars a month through wire transfers. And so they actually went to great efforts. They bought a domain that looked almost exactly the same. All they did is they changed out a W in the domain name with 2 V's. You'd have to look at it really closely to notice it. They masqueraded as the vendor. They knew exactly how to phrase things because they'd been watching email messages. And in this scenario, this customer lost $15,000. not a huge amount of money, but ultimately it was money that didn't need to be lost anyways. And that money could have been easily spent to protecting the customer. Another customer who took all of our security recommendations and thankfully, because this has turned out really well for them, so they built or worked with a large car dealership, and this car dealership owed them several $1,000,000 worth of construction fees, and my customer reached out to get payment because they hadn't heard of anything for a while. And the car dealership's accounts payable team said, hey, we've already paid this bill. We paid it like yesterday. And they said, well, we never received it. Did you send it to this bank account? And they said, no, we got your email last week that it's going to this new bank account. And so what had happened was this car dealership had been breached as well. Their email system had been breached. The hackers had gotten into the accounts payable team's email address or email account and had been watching, and they realized there were really big payments being sent back and forth. So in this scenario, my customer's customer was the one who didn't take the security recommendations from their IT group. And unfortunately, they paid or they wire transferred $2 million to an account, and that money was gone. The car dealership then, realizing that they were in deep doo-doo, engaged their attorneys and their insurance company and basically told my client, hey, we think that you guys were hacked and somebody's going to have to pay for this, and it's not going to be us. And so be prepared to get a letter from our attorney, and you should notify your insurance company. So they brought us in. They're on our advanced security package, and we were able to go through, pull log files, and it was very easy for us to show the car dealership's attorneys that the breach didn't come from our side and that we had security controls in place. So what could have been a costly legal battle turned into really a non-event. And it was really the matter of the customer just spent a couple bucks a month doing the right security things. So those are a couple of examples of the most common ways that they're getting in. And so we talked about those examples. So how are they getting in? They're using passwords from unrelated security breaches. Your password and your username is probably already breached. It happens all the time. I have a little personal example of this. So I use an app called MyFitnessPal. It lets me track diet and exercise. I have used it for years. I had my email address as my username, and I had a password in there that I have used for decades. And I used it on every account that I had that was personal. MyFitnessPal was breached. It was no one notified me of it. They didn't even post it on the app, and I had no idea. So ultimately, my username and password showed up on the dark web for sale. In that scenario, the only thing that saved me is that my company has an identity theft protection insurance plan in place that includes identity theft scanning for the dark web. So the identity theft company, they found my username and password for sale, and they reached out to me via text that morning, said, hey, we found this. Does this look like what you would be using? I said yes, and they said, we recommend you drop everything you're doing and go change your username, change your password on every account that you're using this on. I quickly realized that I had that password on every account, bank accounts, credit cards, financial institutions. I was able to make changes. I didn't lose any money, and I didn't have any identity theft, but I wouldn't have been notified if it hadn't been for my identity theft protection company. MyFitnessPal didn't do anything about it. They didn't notify me. So passwords are out there. They're breached already. And so I'll go into some more detail of how to fix that. The other one is the email phishing. So we talked about that. Someone gets an email. It looks like it's from their boss or a vendor. And ultimately, it's not. It's from an outside entity that's crafted a very convincing email. And then social engineering. So I'll just briefly touch on this. And Jenny, I love talking about this, so you'll need to tell me if I have if I'm going into time constraints. So recently I was mentioning those big casino breaches. So those happened with what's called social engineering. And that is where a malicious group or entity pretends to be somebody they aren't and convinces the staff at a company to let them into the computer system or let them pass the security checkpoints. So the receptionist at a company is usually a very big target for social engineering because they're oftentimes young, they may not be well trained, and they turn over a lot. So they use those techniques. I know in my own business, although I use it for good, I will socially engineer the receptionist frequently because I need to get past her to the next person I need to actually talk to. And so I say things like, "Hi, I'm Andrew. I'm the IT. We're doing an update. Hey, can you get me access to such and such's computer?" They shouldn't be saying yes, but they always do. And I'm doing it for good, but that's a technique that happens frequently. In this recent breach, so I said the MGM Grand Casino, there was one other, the name is slipping my mind. What happened was they actually exploited the IT department's help desk, and it's in a very expensive hack. So the malicious entity that got access to a vice president's email account through likely a phishing email or through an unrelated password breach, but they had the password. What they didn't have was the multi-factor code that would let them then get past that password. So this entity called up the help desk at the MGM Grand for the IT department and said, I'm Donald J. Big Guy, and I'm the vice president. I'm the big deal, and I need you to reset my multi-factor code because I can't get in, likely using several techniques to trigger panic, like I'm going to fire you, or you're going to be reported, or I'm really frustrated by this. And so unfortunately, the help desk person reset the multi-factor code. This allowed the malicious entity to then take the code, regenerate it on their own phone. Now they had access to this vice president's account, which had deep access into the computer system. They went in, they crypto locked everything. And the last I heard, this has been a $180 million ransom that's been put up. And of course, business doesn't happen until that's paid. So in this scenario, the social engineering was very, very deep and very sophisticated. So how do you keep them out? So you adopt security policies and procedures, and you enable them at a corporate level so that you can reduce the risk. So Jenny, from our surveys, can you tell me the percentages on the first survey, the compliance one, as far as how many people have actually been audited?
So we had 4 responders. So one person, one of the 4, so 25% has been personally, either you or somebody has been audited by HHS, and 75% had not.
Okay, and then for the security survey, what were the percentages on that?
I believe that one actually was 100%. Everybody either personally or their clinic or somebody they knew had been a victim of a security breach.
Okay, perfect. So those results are pretty common as far as what I expect. When I was at the conference, the rheumatologist, 75% had actually been audited. So I told them that they were either an untrustworthy group or that HHS had something out for them. They all laughed. It's likely because they do a lot of trials in their clinics, and so they're heavily regulated. But in general, the compliance audits are very small percentages compared to the security breaches. And so that's where we come to this next part of my discussion, which is compliance is dirty little secret. The truth is, Health and Human Services doesn't have the resources to audit you. They just don't. And almost every security framework that we monitor for customers, we have DFARS for the Department of Defense, we have RESPA. None of those regulatory bodies have the resources to audit on a regular basis. The only ones that we see getting regulated are the banking industry. So that being said, the likelihood of an audit is very low. But that doesn't mean you don't be compliant. I'm just telling you like some of my recommendations on how we go through this. So if you do have a breach, Health and Human Services has to become involved, and they have to engage with you. And so the goal here is, if you don't have a breach to start out with, Health and Human Services is likely not going to be engaged. And that means that you're likely not going to have an audit. So we want to be spending resources where they get the most value. So the first one would be, stay under their radar by not being breached. And the way we do that is we implement security controls that prevent or reduce the risk of those breaches significantly. We want to make your business or your clinic a hard target. So this is the meat of the technical side of our discussion here, and so I'll go through this. The first three sections, which are passwords, multi-factor authentication, and backup, are so important. I actually have slides just for those. But the next sections are things that I would expect in the modern world that likely are already in place for your organization, but definitely need to be checked on. So the first one, admin restrictions. Basically, if your computer, when you log onto it, if you can install and uninstall programs without a password prompt, you have admin rights, which means it's really convenient for you to be able to do work. It's also really convenient for a malicious entity to take control of your computer and use your account to do bad stuff with it. So we recommend that admin rights be removed from accounts that don't need it. So if you're a business owner, you probably need a normal day-to-day account, and maybe you have a special admin account that you keep the username and password in a safe in your office, and you only use it when you need it. I run an IT organization and make changes all the time. My day-to-day account is a normal account. It doesn't have special permissions. I have a special account I use. This specific security control, if you remove admin rights, it makes a tremendous amount of difference. We went from computers that had admin rights would get viruses frequently. We mandated to our customers they had to remove admin rights. It generated a ton of complaints. It generated a ton of frustration. But once they realized they could still do their job, all of a sudden the viruses disappeared. I truthfully can't remember the last time we had an active virus on a PC because admin rights were how they were getting the programs installed. There's no cost to remove admin rights. It's a setting that takes about 30 seconds to fix. So I highly recommend you remove admin rights. Antivirus and anti-malware. So this is the software that runs on your computer or your phone or your tablet that scans for malicious programs. A lot of customers will have free versions. What I'll tell you is free versions don't have the ability to be centrally managed, and that's why they're free. For HIPAA has measures that specifically state you have to centrally manage your antivirus, centrally manage your updates, and so forth. So if you have free versions of antivirus, you're one, not meeting the HIPAA mandates or measures, and two, you're basically, it's impossible for you to get a bird's eye view of what's happening with your antivirus or update it at a central level. Admin restrictions, I passed over this. Also, removing admin rights is also another HIPAA measure. So if you have admin rights on your computers, you're not meeting that. The next one, email security. So a lot of us have the antivirus that comes with our email account, which is fine if it's a consumer or a personal account. But if you have a business account, you likely need to have a premium email security program. It's usually antivirus and spam. Once again, these can be centrally managed, they can be configured, and they can audit effectively. Patches and updates. So almost every computer out there has the ability to get patched, and you can turn that on for free. Once again, though, it's at a per PC level. It's not centrally managed. So you can't, one, meet the HIPAA measure, which is central management of patching and central reporting on patching. And also it takes a lot of effort to manually watch the patching. And then the last one is the staff training, creating written guidelines for your staff members, giving them time to do their training and actually following up to make sure that they're doing it successfully is a really critical part to what you're doing. A lot of these on this list, I'm over here because that's where I'm seeing it, they're basically things that you can implement for little or no expense and provide a tremendous amount of value. Without these things in place, you're going to see breaches happening because these are the things that are being exploited. So I'm going to just really quickly jump through password management. So like I mentioned before, your password is likely already breached. And so what we recommend to get around that is an enterprise class password management system. We use one called Keeper, And what's great about it is it lets all of our staff have what we call a personal vault where they keep all their passwords, as well as shared vaults where we can have passwords that are like, shared between the accounting department or the HR department. And then that way we have unique passwords and we're not posting them on sticky notes. We're not sharing passwords. And so the password management system is great. Along with that is multi-factor authentication, which is a fancy way of getting a code that you put in after you enter your password. It's called MFA, 2FA. It just depends on what the vendor or the system is using. And in the end, we recommend implementing that or turning that on every system you can. Really, multi-factor authentication is the last line of defense when a password has been breached. And it is very hard for someone to get past multi-factor authentication if they don't have that code. Obviously, this you call the IT department, they give you the code to reset it, that's a problem. So, social engineering is there. So what we do is we recommend you put an authenticator app on your computer, like a Google Authenticator or a Microsoft Authenticator. Backup and disaster recovery. So these are two things to be aware of. So your backups, you should be backing up to what we call local appliance, which means it's a computer on at your office that takes a copy of your data. That backup then gets replicated to a secure cloud environment, which means it goes somewhere else. And so let's say it's on the internet somewhere. That site then has multi-site replication. So you might have a West Coast and East Coast place where it's stored. Verification that the backup is happening. Retention policies. How long do you keep the data? HIPAA mandates 7 years, and I know there's a lot of medical legal that requires almost 18 years depending on the patient. So you want to make sure that your backups are meeting those retention policies. Classification of data. You want to make sure you know what data is EPHI, what is just standard business, what is bulk data that you like pictures and so forth, and classifying those differently so you can have backup systems that meet those different types of data classification. HIPAA wants you to classify your data. That's one of the things. They also want retention policies and offsite backups. So a lot of these things tie together with what HIPAA guidelines. Logging and alarming who's looking at your backups. And then air gap. So an air gap means that your backup system, when it backs up to the cloud hosting, that there's no way to actually delete it. And that happens, so like in our case, we have an air gap backup system we use for customers. So if we back up something and then it's back, the backup is then in the hosted cloud, we can't actually delete that hosted cloud backup for a certain period of time. And that is the air gap. And what that does is it prevents a malicious entity that maybe has gotten a hold of our usernames and passwords from going in and deleting those backups. So that in the backup world, the air gap is the last line of defense. Disaster recovery. So if you have that local appliance, it means you can recover very quickly from a failed system. If you have a cloud recovery environment, it means you can recover in the event of a fire, flood, or site disaster. You have disaster recovery testing on an annual basis, meaning you actually pretend like your building burned down, and how do you turn on all these systems and actually verify that they work. And then you have what's called your recovery time objective, or RTO. And this tells informs your security plan saying, we need to have this type of data classification, let's say EPHI, available in 2 hours. The bulk data we have can be available in 2 weeks. And so that way, the IT professional can go through and define how they want to do the backups and how they make them go to the right places. So all of that being said, and I'm wrapping up here rapidly, those guidelines are the ones we say are today are standards and really should be implemented. On the screen are the security controls that we're calling next gen. So these are the controls that my firm is implementing for our advanced managed security customers. And they actually are going to have a whole presentation on their own. And so Jenny, what is the date of that presentation that we're going to be going through these next generation security controls?
So that's scheduled for December 9th, Saturday at this same time, and we'll have a recording available as well. There'll be a second webinar login for sign up that'll go out.
Okay, terrific. And anybody who registered for this presentation will get invite to that as well. Is that correct?
Yes.
All right, terrific. So I highly recommend you go to that. These are technologies that are emerging on the scene. In our firm, we have 2 certified security experts who work with national level resources. And so we have been designing these systems. Like I said, they're emerging, they're next gen, and very, very cool systems to not just prevent attacks, but actually proactively prevent them by going after these hackers. So I'll be happy to chat with everybody about that in a few weeks. So in summary, so the first thing that we would recommend is you find your IT professional or your IT management organization that can implement secure passwords, multi-factor, admin rights, antivirus, email security, and patches. This is going to prevent you from being an easy target. They're all very accessible. Any IT professional should be able to implement these items. And really the only thing preventing them is the organizational structure at your clinic. So if there are things we hear of, oh, that's going to be inconvenient to the staff, that's going to disrupt my workflow, I don't have time to deal with that. Those really aren't effective excuses, and they certainly don't, if you were audited by Health and Human Services for HIPAA, they wouldn't take those as legitimate excuses, but they are going to look for these security controls to be in place today. These are considered standard, industry standard security controls. The second thing I'd recommend is do compliance next. Although compliance is supposed to come first in the structure of a compliance and security framework, it's expensive, it's time consuming, and if you don't have a breach, you're going to have a little more time for the compliance. So look through that NIST documentation. If you aren't the person who needs to fill it out, get it into the hands of your IT professional, have them go through and do an audit for you. Take time to do a gap analysis, maybe make it a week, like an hour a week, or you have a 2-hour meeting a week, and you just start working through the process. Health and Human Services during any audit is going to be much more lenient if you show that you're trying to work through the process. They're also going to be way more lenient if you have a lot of those security controls in the first priority listed. And then the third priority is implement those advanced next generation controls that I talked about. So, one of the things I'm very passionate about security and IT. It's my career the whole time. Everyone loves a little free stuff. So any participant or anyone who's registered for this webinar is going to get access to 2 of our ebooks written by our certified security staff members. One is Password Management for Business, 10 tips to keep you safe, and then 13 tips to secure your organization that are almost free. Read through these, please, reach out to me and ask for them, and I'd gladly send them to you. I'm also happy to send you a copy of the slide deck. And then the big one is anyone who's attended or has registered gets the opportunity to have a 1-hour complimentary consultation with myself. And we can talk through compliance and security at your specific clinic. At the least, I can be a second opinion if you have questions or you think your current IT professional is maybe missing something, or point you in the right direction so that you can start on this journey yourself. So you can either email me at my email address below, or you can scan that QR code and your mobile phone will generate the email. So just send me the email and I'll send you all this stuff. So thank you very much. I'll stop screen sharing here, Jenny.
Yeah, thanks, Sandy. That was amazing. I will tell you that there were several moments during your slide where I felt a little sick to my stomach, where you have that like sweatiness of like, are we doing everything correctly? And I think that the point that I would say is that there's always something more that we can do. Breaches are scary. And having been through, I actually remembered when my residency, a couple years after we were out, they lost everything. I can't remember if that was a data breach or if they just didn't have appropriate backups, but I think they had a server failure and lost all of their data, which is the same idea as a breach.
Yeah.
I think quantifying what the cost is of being down in service a day, I think for our clinic, I calculated conservatively, it would be $30,000 of revenue a day if you couldn't see patients. So when you start to look at it that way, I think there's a lot of a lot to be gained. Celine had a couple of questions. She had a question of how frequently does HIPAA training need to be done?
So anytime there's a new system, you should be training the staff on the new system. That should be documented in your HIPAA binder. And then I would say on an annual basis is a good rule of thumb.
Right. And then the other question, so annual basis for that. For health virtual assistants, what are the differences between signing with the VA directly versus signing with the company that offers the virtual assistant? Is there any changes in how you would approach that?
Yeah, so the virtual assistant topic is the hottest topic that I hear of in healthcare right now, healthcare IT. So I mentioned it earlier in the slide, the business associate slide, about the chain of custody. So what that means is anybody who has access to EPHI is a link in that chain. The covered entity is at the top of the chain, and the business associate is a link below the covered entity. So if EPHI is breached anywhere along that chain, it ultimately is going to flow up to the covered entity. So two ways I see the virtual assistants working are there's a direct relationship with a virtual assistant, and then there is a relationship with a company that provides virtual assistant services. So the virtual assistant that's by themselves, they would have to meet all of the requirements to be a business associate. So all of the HIPAA guidelines, all the security controls, all the documentation. I mean, it's quite onerous. And truthfully, I don't know that any of them would do it. The other side is a lot of virtual assistants, we're seeing them come from foreign countries like the Philippines or Southeast Asia. And there's no recourse if they breach at their point and that information comes back, you're not going to have any recourse to go after them. And so you're going to be defending that breach on your own. And likely, if you hadn't documented all the security controls, that's going to also be flagged in the audit. So a company that outsources virtual assistants that's based in the United States, that you can hold them accountable, that they have insurance policies, they have procedures, they have all that documentation. That's what I'm seeing a lot of people are using, because in that chain of custody, they have a much stronger link in that virtual assistant, like outsourcing company.
So one of the things that we've done in our practice, and we did this when we worked with an independent contractor for a charting audit, is that we actually drop shipped one of our own computers that then we provided VPN access into our server so we could control what they were able to get into. And that was, as I mentioned, my IT person for our clinic is here on the call, and that was his recommendation, which basically went around, got away from all of those other restrictions, because we were working with a small company that said, there's no way we can meet all of this 2 pages of measures that are required to be compliant.
Yeah, so. And that is a technique that I do recommend to people who have those smaller virtual assistants or those that are outside of the country, is if you can keep the data in your office as the covered entity and you have that outside person remote in, there's technologies that can basically make it so that only the screen capture, like the screen images, the keyboard movements and the mouse movements are being sent back and forth. All the data resides at the clinic. And so in that scenario, the data is effectively never left the clinic. And so it makes it a lot easier to control that process. So that's one of the things we see.
And you flew right into, that led right into what Celine's next question was. So yeah, so having us as the covered entity control the computer and control all that access and really limit our exposure. So. And
on top of that, the next thing that we also hear in this scenario is, well, I don't have any data in my office or my clinic. I have it hosted. So like I have a hosted EMR that's accessible on the internet. How do I control that? And in that scenario, what I suggest is you have your EMR set up so that it only accepts connections from certain addresses on the internet. So now you're reducing the exposure, you're reducing your attack surface, making sure that EMR, that those people can't copy the data. a lot of times what I hear though is virtual assistants are doing paperwork, administrative level jobs, especially for smaller clinics that just don't have the resources to hire someone full time. Even if you have a hosted EMR, I still recommend having the computer in the clinic that they remote into, because they're oftentimes, they're printing files, they're downloading documents, they're uploading them again, like faxing is a very common one, adding x-rays to charts, very common, adding labs. So if they're working in an environment where they're gathering data from multiple sources and they're storing it on a PC, you want that PC to be in your office. So all that data, you can say like, that data has never left our office. So that would be how I would do it.
So the other question that we had from Namita, so she says, I've been using AI Scribe lately, Abridge. I don't enter any specific data in, but the note has health information. Should Abridge sign a BAA?
Good question. So this is also another hot topic as AI and dictation becomes so effective. So what's happening is when you're dictating, your voice is going to their servers and they're transcribing that voice into text. They consider that text to be called metadata. And metadata is, for them, they're not looking for anything specific, but for that period of time, that data resides in their system. So they effectively are a business associate at that point. It's some of them will sign BA agreements, but a lot of them, what they'll do is they'll have a statement of security. You probably have to reach out to them to get it, but that statement of security is either they're going to sign a BA with you, and then they will give you documentation about their security measures, their auditing, their training. I had one actually that I was asked to review for a group, and I went on the website and they had all of their statement of security was posted. And so looking through it, I said, hey, this looks pretty good. It seems like they're meeting everything. You know, it's up to you if you don't want the BA agreement. The vendor in this case, they said they didn't actually ever store the metadata. They kept it in memory. And the distinction was, if the power went out, that memory would be gone. And so it was never stored in a long-term storage medium like a hard drive. So they said it was, the word that we use is ephemeral, but basically like it could disappear at any moment and no one could get access to it. So that vendor said, we don't technically qualify because all the data, all the metadata is in an ephemeral state at all times. We never have possession of it. It is just being processed and moved out. But they had a lot of security measures. So I think, you know, it's all about compliance. It's all about building your case and having documentation to prove your, you know, what you're doing. And so, you know, I just said, get all the documentation and put it in your file.
Mm-hmm. And Celine had a question about what about IP address that changes rather than a static IP? How can I restrict the IP address from which the cloud-based EMR is accessed?
Good question. So your cloud-based EMR will have a static IP address and will have what's called access controls. Some vendors force you to put in IP addresses that can be allowed. Some will let you have anybody on the internet have access. So like your clinic, likely if you have a business class internet connection, you probably have a static IP associated with it. So that means you have the same IP address every day, all the time, and your EMR could be told this IP address is allowed. Dynamic addresses are usually assigned to consumer internet connections, which is probably what a virtual assistant would have. In that scenario, and this is, we'll get more into this in the next video. So there's an emerging technology called zero trust networking. And what that means is a little program is installed on every computer that you want to trust. And those computers, their connection to the internet or to the EMR are filtered through a third party called a proxy. That proxy then has a static IP address. So we would then tell, you know, let's say your EMR is told only accept these IP addresses. Your proxy company has those IP addresses. Your virtual assistant is going through the proxy company, so they look like a static that's approved. But what's nice is because they have this zero trust networking agent, they can move anywhere around the world and get different IP addresses, and it doesn't matter because that agent is controlling the connection to the EMR. And so, like I said, I'm a whole presentation to talk about that technology.
Great. That sounds exciting. So what I would love everyone to take from today is I think we can all find one change we can make, whether that is, making sure that everything is multi-factor, whether we are doing one of the things we do in our practice is we do phishing challenges. So like we get emails that come out and is this a phishing scam? Is somebody looking for information? So that, and I, at least hopefully out of this, one or more questions you can take back to your IT person to make sure. Because again, as a business owner, as a full-time family physician, we are caught up in our day-to-day, seeing patients, taking care. And so having our team and knowing that our team is taking care of these things on the back end is huge. So I want to thank you guys for taking time on a Saturday with us. Andy, thank you for this information. These are the kind of things we talk about all the time, but it's really great to hear it in this realm as well. So.
Terrific. Thank you for having me. And once again, anyone who would like to utilize that complimentary consultation, happy to chat with you about your specific scenario for an hour and hopefully give you some pointers and point you in the right direction.